I think we should take it away. There is a lot to talk about. So
There's a lot to talk about. Great. And we have a handful of updates at the beginning, and then we're going to dive into talking a little bit more about early childhood policy and programming, but wanted to give a few updates on the youth side, and I'll just kick it off with a couple updates on my side and then turn it over to Commissioner Forkman for a couple updates on pre-apprenticeship and apprenticeship programming. And so just very quickly, just wanted to give an update on the work that we've been doing at the with the Children's Cabinet staff around building ecosystems for thriving youth, and that initiative that we're working on with the Forum for Youth Investment. It's a cross-sector team, cross-agency team of folks from DOL, DHHS, DOC, DOE, and GOPIF. And we have in addition, we have three young people with lived experience and one parent with lived experience that are helping us to look at how we can coordinate across agencies and with communities and folks from the community to improve youth development programming with a focus on peer mentoring programming and near peer mentoring programming to improve outcomes, particularly for young people that are disconnected and disengaged from school, community organizations, or and also family. The TA team that's working with us from the Forum for Youth Investment came to Maine last fall, and they connected with our staff as well as a number of community-based organizations that are working with young people throughout the state that are working with the state in partnership. And they're pulling together a report for us to provide some recommendations for how we might move forward together as a group, as a team. So we will be providing more information about that at the next Children's Cabinet staff meeting, but just wanted folks to know that work continues to move forward. In addition, at the next Children's Cabinet meeting, we will also provide an update on the Career Exploration Program. In the first 2 years of the program reached almost 6,000 students with career exploration opportunities, including the Maine Career Badge, which was led by Jobs for Maine graduates, the extended learning opportunity work that was led by the Department of Education through their work with 23 schools and 3 community-based organization partners. And then also the CBO work, they work with community-based organizations that was led by DECD, a combination of DECD and myself at the Children's Cabinet. We were able to reach more historically disadvantaged young people. So we will have more information about the final evaluation that the Disability Innovation Fund that has been not Disability Innovation Fund, sorry, that the folks at Cutler, their evaluation team has put together an evaluation, and they're finalizing right now of the first 2 years of the program. So we will have information on the Career Exploration Program. We had a presentation from that team last year around the interim evaluation, and we will have the final evaluation report at our next meeting. So right now, given that we wanted to touch on a couple different pieces of youth programming, we wanted Commissioner Fortman to give an update on the work that's been happening around pre-apprenticeship and apprenticeship programming, and the great work that her team has been doing to reach young people with that programming and really expanding that programming out to young people ages 16 to 24. So Commissioner Portman, take it away.
Great. Thanks, Anna. And it's always a pleasure to talk about the work that's happening around apprenticeship and pre-apprenticeship programs. And as you said, it is a great team that works on this. And that team includes folks at the Department of Labor, community partners, as well as our colleagues at Department of Education and the community college and adult ed. It really is a framework that allows for multiple partners to not only participate, but to help shape it. And employers are kind of a key connector. So for those of you who don't know, registered apprenticeship is an earn while you learn program. You must have a minimum of 144 hours of related classroom instruction and 2,000 hours of on-the-job training. And at the end of it, you have a recognized certificate that is portable. You can take it anywhere, and wherever that apprenticeship is used, you will be able to demonstrate that you have the qualifications for it. So registered apprenticeship has been around for a very, very long time, and it's been formalized in the state of Maine since, I want to say, 1940, but it may even go back a little bit further than that. What is new, though, is a certified pre-apprenticeship program. So this is a pipeline that allows, although it can be folks of any ages, we've been pretty laser focused on young people, as Anna said, between the ages of 16 and 24. This gives them a structured environment to try out apprenticeship programs. And last year we had 451 young people participate in either a certified pre-apprentice, and Maine is, I don't know if we're unique, but we've formalized what it means to be in a pre-apprenticeship program. It is different than an internship, and I know sometimes it's easy to confuse internship and registered apprenticeship, but even in our certified pre-apprenticeship programs, there are a couple of elements there that are really important. One is that hands-on experience. The other is you know what the skills are that you're going to be learning, and at the end of it, you receive some certificates that demonstrate the learning that you've obtained, as well as a path into registered apprenticeship programs. So you've got the skills at the end of it to enter a fully recognized registered apprenticeship program. So we had 451 young people. There are currently 45 certified pre-apprenticeship programs in the state, and 80% of all pre-apprentices have successfully completed the program, and about 30% of them have entered a registered apprenticeship program. Now that's important. We've talked a lot here. Doesn't mean that every person who goes through a pre-apprenticeship, we think it's a great opportunity to try it out and to learn early. That's not for me. This is an opportunity to explore and to receive information in a very supported way. At the end of the apprenticeship, I just want to give you, so these are short-term programs, usually 4 weeks, 8 weeks. It's a maximum of 6 months. But at the end of that program, for example, the AFL has a program working in the construction trades. And at the end of it, every pre-apprentice walks away with an OSHA 10 certification, which can be is incredibly valuable, and you're going to need it on any construction site. First aid and CPR certification, and that they are guarantee anyone looking to interview them for a registered apprenticeship program knows that they have the skills that are needed to enter a registered apprenticeship program in that occupation. Some of our other partners, for example, AGC, they also guarantee that that the certified pre-apprentice would have the opportunity to interview with employers who are going to be hiring folks in those fields. So again, key pieces: direct connection to employers, a schedule of work that clearly lays out the skills that you're going to learn, and at the end of it, you have certificates that you take with you that can help you as you transition, whether it's into a registered apprenticeship program or a career. So I think I'll stop there, Anna. But
Great. Thank you. Any questions for Commissioner Foreman or for me? Great. I did want to make the connection that I forgot to make, is that the team from DOL and DOE and DECD and myself also meet so that we can make sure that there's opportunities to make connections between either the ELO programming or the CBO, the community-based organizations, and make those connections to pre-apprenticeship and apprenticeship, registered apprenticeship. So just for example, EMDC that oversees one of the grants, our Children's Cabinet grants, actually has made connections to the Associate General Contractors and their pre-apprenticeship program, and put young people in there to make sure that we're making those connections and opening up opportunities as we're supporting young people to do that career exploration work. So lots of work happening across agencies to make those connections. Now we're going to switch to more conversations around early childhood, although it will include some work around some school age programming as well. We're going to start with hearing from folks at the Office of Maincare Services. Olivia and Maggie are here with us to share their exciting news. The Office of Maincare Services was selected as one of 15 state Medicaid programs to participate in the Transforming Maternal Health model. And it's just a great opportunity. We've talked a lot in this group about the perinatal systems of care work, lines perfectly with that work. And I'm going to turn it over to Maggie and Olivia. And again, congratulations on your great work. Excited to get this work kicked off. It's a 10-year grant, and they'll talk a little bit about the planning stages of the grant.
Great. Thank you so much, Anna. Yeah, we are here. You're our first group that we're going to present to since we got notice of this award earlier this month. And as you know, the grant has already started. So we're in on our 10-year opportunity here, and we're very excited about this. We think it's going to really help Maine move forward this work with this additional investment, and also with giving us a very clear set of priorities, at least from a Maincare perspective, that we can web and blend into all the other priorities that are happening statewide around this work. So we have, let's see, like you're not seeing the slides advance.
And we're not.
You're not seeing. You're seeing the weird view.
Yeah.
Okay. All right, let's try again. How's it now?
Hasn't come up yet. There it is.
Oh,
although it's got black boxes on it. There. We can see the slides though, Olivia. So there you go. There you go.
I'll move one black box. All right, so this is from an opportunity from the federal government, the Centers for Medicare and Medicaid Services. It's a model that they've been developing for many years, and it's focused exclusively on maternal health for people enrolled in Medicaid and CHIP. It is focused on the Medicaid agency playing a greater role in advancing maternal health priorities in their state. And what we really liked about this opportunity and what the federal government took as feedback was that if a state's going to embark on this type of work, it would be nice if the model lasted more than a few years, because in Maine, we need, and we were excited to have, this 3-year planning period that's part of this award, followed by a 7-year implementation period. So the 10 years is split up into some planning time and some implementation time. We also are able to then provide some ability to weave in investments and infrastructure throughout the 10-year period. It's a good opportunity for Maine to be very thoughtful about this work. Maine, just to see on the map, was one of 15 states selected for this, and the only one in the Northeast. So just interesting to see nationally where states landed. What we hope to see as benefits, again, is just an increased access to high quality services for people across the state of Maine. We will absolutely be building on and looking to sustain existing work through this money as able and appropriate. It also, from a Maincare perspective, will result in some expanded coverage for services and supports. We're talking about things like doula services, home monitoring, other things that over time, Maincare, with appropriations, will be able to kind of increase our investment for maternal health services and supports. But it also looks at building health equity plans for the state as a whole. This group, along with many other groups, are going to be part of the partners, hopefully, in moving this work forward. This slide was meant to be overwhelming in the sense that there's so many people who will be critical to the success of this work, and there will be plenty of opportunity for us to engage and plan, again, the 3-year period, but also through different work groups and committees where we'll be present and working through some of the operations and plans for this. if you don't see your name on here, that's not to say that you won't also be included, but it will be a whole group effort. Really quickly, we just want to cover some of the areas of focus for this work. It's really, from a federal perspective, access to care, infrastructure, and workforce are one pillar. Quality improvement and safety are the second, and then whole person care delivery is the third. Many people have found it helpful to see this list on this slide, which shows you the areas that Maine is both obligated to focus on from a federal perspective, the top 10, but also the 4 areas where Maine selected additionally to focus on some optional elements that we thought were most relevant to Maine. I'm going to walk through really quickly some what these items mean in more detail to Maine. But again, when you talk about the optional services, many of those came out of feedback from you and many others about the need to support community health workers, regional partnerships in rural areas, and just broader access. So for Maine, we're thinking about, again, expanding opportunities and touch points for people to have maternal health services and supports wherever they live. So I'm not going to read all of these boxes, but I want to highlight a few things about this. And Anna, we can share the deck later. But what the investments that this model makes are hopefully going to be impactful. They'll include investments in data infrastructure to support providers, but also to support state agencies and better linking our data to serve the people of Maine who can benefit from us treating this as more of a whole person approach to services from a outreach and education perspective. There will be funding for providers that goes out in some of the later years of the model to support their infrastructure development for care, what we call care delivery transformation activities. That will include a wide range of providers that are intended to be eligible, fairly qualified health centers, certainly hospitals and health systems, DH community health workers, other folks who are delivering maternity services are intended to get some of this provider infrastructure money. And then from a payment perspective, which is one of the things that I think many people will care about, is that from a MaineCare payment perspective, we'll be working with the federal government around a new way for us to pay for maternity services, which could include hospital and professional services being tied to performance metrics that relate to high quality care delivery. This will be a point where we'll work with federal partners to develop this model. There are other community-based providers that are also impacted and intended to be enhanced by this model. We'll look at certified nurse midwife coverage. Licensed birth centers is an area that we'll explore. Maine will be taking a step here just to learn how other states are interacting with birth centers, licensing birth centers, and potentially what that could mean for our future options for Maine licensure or payment. Currently, Maine does not license birth centers, so this will be a new area for Maine to kind of think about and revisit how we interact with birth centers. And then doulas, something that many folks are working on, will be part of a statewide doula advisory council that will develop with many different multidisciplinary partners to figure out how doula coverage fits into the puzzle for maternal health access. There'll be a number of quality improvement initiatives that will build on current work, primarily related to patient safety bundles that the Perinatal Quality Collaborative of Maine is already working on, and then also just other ways to enhance the quality of care through birthing-friendly hospital requirements and thinking about group prenatal care as a way to deliver high-quality care to MaineCare members. I'm being very brief because I know we only have 10 minutes. The last few slides here are showing that this model does have a number of elements related to whole person care delivery and making sure that we're screening people for all of their needs that may be able to be addressed during this time period and linking out to community partners, including CHWs being important to not only this element, but all of the elements of this model where they can play a role in improving the health outcomes and the experience of care for people in this time of their lives. And I've mentioned before that there will be a statewide health equity plan that we will be dedicating some resources to seeing some real improvements on in that area. And lastly, I mentioned the real rural focus of this model for Maine will be important, and we've built this in very tailored to Maine, that will support regional planning efforts in the rural areas, telehealth supports for people, and home monitoring as an example of services to support people with their monitoring for issues around hypertension or diabetes, really tailored to this population and the needs that we have in Maine. So we don't have an answer yet for how to engage with us on this work, because we just found out and we're trying to develop the governance structure, but there's absolutely going to be lots of opportunity, and we'll look to coordinate with this group whenever possible. In the meantime, if you have questions, Maggie Jansen's our wonderful Maincare Maternal and Infant Health Coordinator. We're working with the Maine CDC and other folks very, very closely on this project, but you can reach out to Maggie if you have questions in the short term. I'll stop there and just see if there's anything that you wanted me to slow down on or provide more information on.
Any questions for Olivia? And Olivia and Maggie, we will definitely have you come back when you're a little bit further along so we can continue to work on this together. It's really exciting work, and it definitely aligns with some of our preschool development grant work as well. We have partnered with Wabanaki Public Health and Wellness, and they will be leading a series of doula trainings, as well as developing birthing classes, Indigenous informed birthing classes. So there'll be many opportunities to partner on that work as well. But we look forward to continuing to hear about this work as you enter the planning stage and start to build out more partners.
And thank you to the Children's Cabinet for your letter of support for our application. We appreciate it.
Great. Well, seeing no questions, I'm going to move us on to, we wanted to spend a bulk of the meeting really talking about some work that many of the Children's Cabinet staff members have been immersed in around community collaborations. And it involves a number of different initiatives. And I'm going to pull up some slides to share with everyone. And then we're going to have different folks sharing different series of slides. But I'm going to pull up a slide that walks through, if I can, there it is, walks through just highlights some of the work that we've been doing. Just hoping, let me just put this into presenter mode. Can everyone see the slideshow?
Yes.
Not yet.
Some people, not everyone.
We can see the slides, but not in slideshow.
Okay,
Right.
that's what I will do. Okay, great. There we go. So just quickly, there is a cross-agency team that includes staff from the Department of Education and the Department of Health and Human Services that have come together that are involved in work related to the care and well-being of children and families. We call ourselves the Whole Student and Community Collaborative. And we've come together working on a variety of initiatives to ensure that our work is coordinated as we look at building and supporting collaborations, more collaborations at the community level. We have a real focus on ensuring that we are supporting and identifying ways to support collaborations between, particularly between schools and community-based organizations. But the work involves collaborations that also just include community-based organizations. And it really provides us an opportunity to ensure that we're not duplicating services, that we're learning from each other, and that we're really starting to develop materials that can support and facilitate more of this work at the local level. So we're kind of modeling the collaboration across agencies in the hopes that we also can facilitate and support greater collaboration at the community level. There are some examples of some really strong partnerships that have already established at the community level. I think we've had the Community Caring Collaborative come and talk to this group. And the work of the Child Safety and Family Wellbeing team that includes the Maine Child Welfare Action Network, as well as the team at the Department of Health and Human Services. They have kicked off some work to support the Community Collaborative Network and are providing technical assistance to community collaboratives. That work is being spearheaded by the Maine Child Welfare Action Network. So we've invited Melissa Hackett to come talk with us from Maine Children's Alliance, along with Mariette from the Commissioner's Office. So I'm going to turn it over to them to lead this part of the conversation.
Anna, real fast before you jump over, I wanted to make sure you saw Sheila's note that right now what we're seeing on the slides is the presenter view. We didn't know if you meant to do that.
I did not. This should do it. There we go. Thank you, Sheila.
Looks good now. Thanks, Anna. And thank you so much for that introduction, and great to be here with all of you again at the Children's Cabinet. Really are grateful for the opportunity to share more about one of the many efforts happening across the state to strengthen partnership and collaboration at the local level. I am here to present on the Community Collaborative Network, which is part of the Child Safety and Family Wellbeing Plan, which, as Anna mentioned, is a partnership between the Department of Health and Human Services and the Maine Child Welfare Action Network. At prior Children's Cabinet meetings, I have presented about this plan, but as a reminder, this plan is a comprehensive effort to keep children safe by keeping families strong. And the first version of this plan was released in May of 2023. And focused on the creation of this coordinated system for child safety and family well-being. Some of that plan included promoting supportive communities where families feel comfortable seeking help and that resources are accessible and available. And so a lot of that is focused on how to support partnership and collaboration at the local level to meet those needs. We conducted robust community engagement and partnership with families to inform the first version of the plan and the forthcoming long-term version of the plan, and supporting local collaborative infrastructure continued to be something that we heard from community partners and families. So one of the actions included in the first version of this plan was to support the creation of a network of community collaboratives, which the Maine Child Welfare Action Network has led on. And so I will now turn things over to Melissa Hackett to share more about what it means to be a community collaborative and what that network has entailed.
Thanks, Mariette, and thanks to the Children's Cabinet for inviting us to be part of this presentation today. As was noted, we really are in deep partnership with DHHS and OCFS in this work around the Child Safety and Family Wellbeing Plan, recognizing that there are certain activities that the state partners are better poised to lead on, and certain activities community partners like McQuan are poised to lead on. So we have been really providing the capacity to support this network. In December of 2023, we launched this network of community collaboratives, and really did that through an identification process of what we understood were already existing community collaboratives. We had to start with kind of a rough definition of what we meant by a collaborative in order to do that identification, and asked participating collaboratives to do a little bit of an assessment process to ensure that we were kind of on the same page about what we meant about the work that was happening and how we would go about defining that. That really did lead to a year-long process of getting deeper into what we meant by a collaborative, but I'll get into that later on. I just want to name that, lots of folks use different language for this. We use the term community collaborative. Other folks might call it a hub or a coalition. And really just identifying the core concepts of what comprises a community collaborative. And it really is a broad group of people who are committed to developing better ways to help people in their communities. All the collaboratives that we talked to were very interested in across the lifespan, not really being focused on one particular issue or demographic, but really being responsive to the changing needs of the community and pivoting around those needs to be more responsive. These tend to be led by local nonprofit organizations and sometimes community members. They're often funded, at least in part, by philanthropy. And I'll note that in a lot of places, it's in-kind support from those organizations to provide staff capacity to do this work and facilitate it. And it really does create this essential opportunity for local collaboration by providing that infrastructure to convene partners, hold meetings, that really supports relationship building among many partners and members in the community, and provide some coordination for identified activities and resources. When we talk about what a collaborative does, it sometimes doesn't sound like the most exciting work, right? Bringing partners together, holding meetings, doing follow-up. But when we did that community engagement with folks in the development of the plan, so many people articulated that if they were part of a collaborative, it was really essential to their ability to partner with others in the community. And that if they didn't have a collaborative, they were jealous of partners that did have that, because it really provides that capacity for a variety of partners to work together. Thanks, Anna. So year one, we really brought those folks together, and it was kind of interesting to realize that we had identified these different collaboratives, but they were really regionally focused and they tended to not be talking to each other. So for instance, the Community Caring Collaborative might be doing really amazing work in Washington County, but Helping Hands with Heart in Piscataquis County might not be knowing what's happening in Washington County. So kind of, it felt to us like a missed opportunity for the folks who were doing this innovative work to connect with each other, to share pain points, to share lessons learned, and to think about replicating things that were happening in other communities. As part of that year one work, as the core team of the Child Safety and Family Wellbeing Plan, we really thought about the other entities that are doing this partnership and community-driven models, and didn't want to silo these from each other, right? We really think these are the partners who, working together, can really ignite collaboration. So we brought together the prevention councils, community schools, First 10 schools and communities, school-based health centers, and First for Me, to kind of get to know each other, learn from each other, share what they were doing, how they might bolster partnership with each other in these communities. And then, as I mentioned, we really spent this first year of work focusing on developing a concept paper that developed in a little bit more clarity what we mean by a collaborative in Maine, and really getting to some of those core concepts. And that was really identified by the collaboratives as needed to help partners understand the work that they're doing and to be able to pursue funding for this really essential, critical community infrastructure. The plan for year two is to really shift toward a community of practice model. So ongoing technical assistance and support that's really directed by the collaboratives. What do you want to learn more about? What are you struggling with that we could provide some assistance with? And then additionally, looking to identify and recruit collaboratives in areas of the state that we don't already have representation. So as I mentioned, we really spent a lot of time digging in with the participating collaboratives to identify what we mean by a collaborative. And they were all very careful to say, it can look different in every community. It probably should look different in every community. We want to make sure that we provide some kind of an outline of the core concepts and the activities, but we also want to make sure we're leaving this flexible enough for communities to decide what they need to do this work together. And these were some of the core components that were consistent across what collaboratives identified, described their work. It really requires local leadership, relational infrastructure. So again, those opportunities to bring partners together to build relationship, understanding, and to innovate together. Financial infrastructure. Most of the collaboratives named that this was a challenge with having ongoing sustainable funding for this work. Access to physical space, and that was both for the partners to gather together. So many people said, you know, if we can gather together in person and have a meal, it really helps build those relationships. Also, they talked about the need for physical spaces for community members to come to access resources. Focus on service and understanding where services were working well and where there were challenges and how the collaborative could notice was a term that was used a lot. Developing shared initiatives. A lot of the partners named that having work that they were doing together was really important to hold the partnerships and to feel like there was progress in the work that they were doing together. And then finally, having intentional change, being able to be really thoughtful about work that was going to be lifted up and carried forward and how that was responsive to what the community was sharing needed to change. So finally, this is the list of the currently participating community collaborative network. I'm in the process right now of identifying collaboratives. I think we actually had a fairly good geographic distribution when we went through that first identification process in 2023. We had challenges with responsiveness from some folks, or, you know, we knew there was some kind of infrastructure, but weren't able to identify who the point person was. So that's the next phase of work, is to really to look at what we already have, where there's representation, and then to look in different geographic areas where there isn't representation. Just a note that you'll see here, some of them are countywide, some of them are more regional. Again, we really tried to leave it open for those collaboratives to identify the sort of geographic reach that made sense for their community. Right.
And we're going to leave questions till the end because we have a few more. We wanted to provide a couple more examples of community partnerships, collaboratives that are happening across with the support of our state agencies. And so I'm going to turn it over to Meg Swanson, who's going to talk a little bit about First for Me, which I know many of you are familiar with. And there's Meg and sharing her screen.
All right, thanks, Anna. Let me go ahead and get. Let me try one thing. Technology today seems to be fun. All right, very good. All right, so my name is Meg Swanson, and I'm the program manager that's overseeing the First for Me pilot. It's a privilege to present to this audience a brief overview. The first 2 slides is really just foundational knowledge. I know there's a lot of folks on the call that are aware of First for Me. And so this is legislatively driven, an act to support children's healthy development and school success. We also share legislation with Help Me Grow, although we have 2 different programs and 2 different goals. It is just important to highlight that. Our goal in First for Me is really to weave some of those legislative mandates from that legislation and the work that was done with our demonstration model at Elevate Maine through KV-CAP Educare to really look at how we would take a community-based program that was seeing some really strong trajectory for child outcomes. How would we be able to move that to a statewide level? What role does the state play, and how would we be able to infuse resources into that? So our pilot has 4 major goals, one being surrounding successful early learning transitions. And so that can be leading all the way up to kindergarten entry. That may be pre-K, that may be an organic transition for another circumstance. Increased sustained high quality care and education. So for that birth to 5 age range, really working intensively with childcare providers in the community, Head Starts, school districts, to be able to really look at that sustained quality. Developing some coordinated systems for all of those that are partners within it, with families at the center, thinking about their process along the way as they're bridged from one system to the next. And then really thinking about strengthening that continuity of care for families to support all their participants. First for Me has 7 core components. One being that a community nonprofit serves as the convener of the program. So we have 4 of those in our pilot right now. That there's a coalition of diverse membership. So there's an opportunity to really be dialed into that unique community design, and that it gives communities the opportunity to be the architect of their own success, being able to, they know their communities best, they know their support systems, but how do we kind of coordinate that work through that coalition? Having at least 1 full-time community coach. We have adapted that language a little bit. We refer to them now as implementation staff, because coaches may do something different than working with consultation, working with coordinators. And so we've broadened that just a touch as we've gotten into the pilot and been learning. At least 1 partnership with a local school district to help with building those coordinations to the school transitions, a focus on early screening and intervention, making sure that families, childcare providers, and school districts have, an understanding of that birth to 5 element. And we're really leaning in and partnering with Help Me Grow around the ages and stages questionnaires to really be able to impact and be able to really inform and empower families around child development, but also having a routine screening opportunity. This pilot also has a 2-generation approach to be able to engage with families. So all adults that care for children, whether they be in the professional arm of early care and education, childcare providers or school districts, or adults that are in the home. And then also the state level staff being able to manage and oversight of the pilot to be able to help again with that coordination and those consistency elements. So First for Me really works to positively impact specific areas of need. So one place is the workforce, really dialing in as we pull back some of those layers of that intensive support with childcare providers. We found that, as we all know, in all sectors, the staff turnover is really impacting the ability to move the dial on sustained professional development, being able to support the adult in those areas. One just data point related to First for Me From January to October, a 10-month frame in the pilot, providers reported that they hired 68 staff, and in the same timeline, they lost 57. And so for that, there was a wide variety of reasons, changing fields, changing jobs, going back to school, lots of different elements, but it is pervasive, even in elements that have lots of support there. Also school and community is another big focus. So being able to work towards shared professional development opportunities with school districts and community providers. So we've had some really strong partnerships in some of our sites to be able to have shared language, evidence-based curriculums, being able to work towards having that unique and aligned momentum. And then always looking at all of the different systems, how would we build efficiency between communities and agencies, but also thinking about it laterally and horizontally. It also gives us an opportunity to be dialed into communities, having partnerships and relationships to really in real time have an understanding of what's happening. This is an overview of where we're positioned as the pilot. This is a 3-year pilot. It began in August of 2023. Currently, we have 18 childcare providers. 7 of them are family childcare providers. The remainder of them are centers. We have 8 school districts that are participating, and then 576 children that are being positively impacted by the pilot. We're about halfway through. The pilot itself will conclude in July of 2026. And after that, we do have an evaluation with the University of Maine that will also provide a cost analysis of this work. So we have been drafting a status report that will be making its way to the HHS committee, and that is per legislation. These are just a couple of testimonials from a few of our providers. We have several others, but it's been a great opportunity. We have learned a lot, and that is part of that status report. Lastly, I just want to highlight quickly that the benefits of these layered collaborative works, oftentimes we're thinking about efficiency and how we can kind of make sure that funding and resources are all across the state. I can say that both in the regions that have First for Me and First 10, which you'll hear from Leanne a little bit after me, we're really seeing some better results because we have investments on both sides in both systems. We have dedicated staff, we have dedicated resources to be able to invest on both sides. There's also conditions around buy-in from administrators, buy-in and understanding with the childcare providers, owners, and directors. But ultimately, we're seeing momentum come together in a way that's a little bit faster than other communities as well. The coordination really does benefit children and families because it allows families to move through these systems a little bit smoother. And what I really appreciated about what Olivia was saying about her opportunity is having that pre-planning and then implementation time. That's one of our biggest learnings, is being able to stand up a systems pilot really required a little more planning and a little more time with each of the communities. But as we've built momentum and as we've gained more time and trust with the communities, it's really been, the momentum is picking up, and we'll continue to collaborate with the Department of Ed, especially around First 10 and community schools, because that is really a partnership that's there. And the conditions around the CDS transition with FAPE and all of the things that are coming along, the need for these local coordinations is becoming more and more evident.
Meg, thanks for going through that so quickly. And just again, as Leanne's talking from the Department of Education, Director of the Early Learning Team, this is really this effort of aligning our systems, really starting with the perinatal, as Olivia and Maggie were talking about, but then making sure that for families, when we're more coordinated at the state level and the local level, the transitions are smoother for families as they go from one system to the next. So I'm going to turn it over to Leanne, who's going to talk about a number of initiatives that are aligning with the work that Meg talked about, of really streamlining the process for families as they transition between systems. So Leanne, take it over. You also have a black box at the top of your presentation. If you go into presentation mode and then maybe move, there may be something at the top of your screen. There it goes, it's gone.
Is that gone, Anna?
No, it's a little bit lower. So this is
Actually,
what
lower,
you're
yeah.
looking at is your toolbar. So if you scoot
Yeah.
your toolbar way to the very bottom of your screen, it may not do it. It's a new Zoom feature. It's really awesome.
Apparently. Okay, is that any better?
Try. It blocks a little bit of the bottom of your screen, but I don't know if there's any way around it. So you can.
Okay.
And there's one on the side you might be able to X out. It might be pictures of all of us, and you could just show, well, I'll leave you alone. It's fine. We can see enough.
All right,
There it is.
is that better?
Perfect.
Okay. All right. Well, good morning, everybody. And thank you, Anna and the Children's Cabinet for having me here today. Anna had asked if I could share some examples of some of the ways that the Department of Education in our early learning space are really working to build collaboration and partnership within communities. So there are 3 different examples that I'm going to quickly share a little bit about. One being our public pre-K partnerships. Then I'll talk a bit about our first 10 community schools, which Meg has already touched a little bit on in her sharing. And then we'll wrap up with a little bit about transitions to kindergarten teen. So in regard to our public pre-K partnerships, in the current school year, about 26% of our school systems in the state have partnerships with community-based partners, and that is often either a Head Start program or a licensed community-based childcare program. On the screen, you'll see a breakdown of those different categories of partnerships. But in terms of promoting public pre-K in our state, we know that the more that we can help bolster partnerships between our school systems and community-based providers in an effort to serve as many of our 4-year-olds who are eligible for public pre-K, the stronger we are able to make our mixed delivery system in the state. Partnerships often provide opportunities for families to be able to keep their children in a high quality setting with fewer transitions throughout the day and more access to wraparound care and comprehensive services. And that becomes a real win-win for children and families in our state. So this is an area that we are working really diligently on. Often it takes time to build relationships between school systems and their community-based providers, but this is something that our team, both the early learning team, but I will also say that my colleagues who are on today's call from our Office of Special Services and Inclusive Education, where Child Development Services is based, as we are working on the FAPE transition, this is something that we are all really working to build those relationships within communities, because serving our 3- and 4-year-olds with early intervention supports often can happen really well through community-based providers. In regard to the first 10 community schools, this is a project that we are funding through the Preschool Development Grant. First 10 community schools are, I often describe them as an example or model of a community school. What's interesting about them is that, as their name suggests, they really focus on the first 10 years of children's lives. And so they are partnerships between school systems or oftentimes in this case, an individual elementary school and the providers within their community that focus on children and families in those early childhood years. It's a model that was developed by Education Development Center, and we've had the good fortune of being able to really build this model in some sites across the state. The model pulls together schools, families, and community providers to focus on stronger partnerships with families, coordination of comprehensive services, and then really thinking about alignment and transition of teaching and learning across those first 10 years of children's lives. In each one of the sites, you'll find a strong leadership team that's made up of both school and community-based representation, including families. And each of our sites has a family outreach coordinator position. Additionally, at the state level, we have a specialist position that is helping to provide technical assistance and coordinating resources to each of the sites, as well as the support that they receive from Education Development Center. This map will look a little similar to what Meg had shared earlier, and you'll see where each of the 7 sites that we're supporting currently are based in our state. Some of them connect to smaller elementary schools, such as the example from RSU 71. And also up in Aroostook County, we have 2 schools, 2 small elementary schools that are actually different school systems, but have come together to share one coordinator. So we're trying to explore some different designs that help us to work to support these kinds of community partnerships. And then just to give you a quick glance at some of the different types of activities and partnerships that are being built across these communities. When First 10 really starts to operate, the pivot point is really that pre-K transition time. Both reaching down into the early years before children are coming into either preschool or kindergarten in their local elementary school, and then reaching up further as they are moving into those early elementary years. So many of the communities you can see are really working to establish transition into school plans, play and learn groups that help build relationships with families and parent education pieces. Many are working on different aspects of community service hubs, whether that be food banks or programs that really link children and comprehensive services, parenting campaigns, outdoor learning initiatives. So each one is very unique in terms of building on the context, but there's definitely some of those threads that continue across every single one of them. And as Meg pointed out, we're seeing some really strong work happening in a couple of the sites that also have First for Me initiatives. And we also have the Cape Cod Hill and Deer Isle Stonington sites that don't have First for Me, but have a community school presence, which I believe Julie Smythe's going to talk briefly about in just a minute. So one of the things we're really trying to look at in all of these models are what are some of the common components that are significant and will make a difference. Like Meg mentioned for First for Me, First 10 does have an outside evaluation. So we will be looking at the different impacts that are coming about because of the work that's happening. And the evaluator from First 10 will also be connecting with the evaluator from First for Me, so that we can do some comparison. And then finally, I'll just share that one of the partnership areas that's often a really good starting place for communities to build partnerships between their schools and community partners in the early years is to build transitions to kindergarten teams and kindergarten transition plans. So also through the PDG grant, we have been funding some mini grants to help support this work. And currently we have 4 of those that are operating in 4 different school systems. Interestingly, you may have seen Sanford pop up on a lot of our slides recently. They've done a great job of accessing resources available to them. And in this particular case, it's enabled them to build out not just a transition plan for their First 10 site, but across their entire school system, which is very exciting. But each one of these sites is being provided with some technical assistance to build these plans and a small mini grant to help fund some of that, with the intention that this will provide them with a really rich kind of a plan that will last from year to year. The other thing that's interesting about all of these plans is that they're not just short term. A lot of times we'll see transition to kindergarten planning that happens just from the time of the kindergarten registration to the beginning of the kindergarten school year. And instead, these plans will span an entire school year, supporting children and families well before kindergarten registration and also after they start kindergarten. through a lot of shared coordination in communities. I think that's it for me, Anna.
Great, thanks, Leanne. And we are gonna have Julie Smythe talk about the community schools at our next meeting. It'll actually align very nicely with the topics of our next meeting. I do not want her to feel rushed. I, as usual, tried to cram in way too much in one meeting. But I think it's a lot of great information. And just to kind of recap on these community collaboratives and partnerships, and these relationships really help communities to leverage their work to provide comprehensive services for our young children and children, school-age children, to really provide that whole student approach and to improve the quality of programming and support those transitions across systems. We've got 2 minutes. Any quick questions or thoughts or that you want to chime in about at this time? Okay, great. And Commissioner Liberty was not able to join us today, but I've also put him on the spot to talk a little bit about some of their partnerships to support parents in their system. So he will talk about that at the next meeting as well. So we will have a packed agenda again at our next meeting in 2 months, but really appreciate all the presenters, all the information that was shared. Please look in your inboxes for this information. It just gives you a good sense of all the work that folks who are working on the Children's Cabinet, help supporting us to reach the Children's Cabinet goals, what we're working on together internally and also with our community partners like McQuan, Maine Children's Alliance, and others. So thank you, everyone. Enjoy the rest of your day and look for notes from me and information from me soon.
Thank you.